Hello, everybody. Welcome to the Bertec Knowledge Series. Welcome. If you joined us before, welcome back. We're really happy to have you. We're recording this webinar, and as we do with all of them, and we'll post them on our YouTube channel that we've launched. We're Bertec HQ, so feel free to subscribe if you haven't already. We're fairly new on YouTube, but we have a pretty rapidly growing list of webinars that we're posting there. We've grown in our viewership over the past few webinars, and it's in no small part due to the caliber of speakers that we have joining us. So we're really thrilled today to welcome Dr. Stephen Thomas to discuss a clinical guide to pitching mechanics and kinetic chain deficits. He is well qualified to discuss this subject. He is the Associate Professor and Chair of the Exercise Science Department at Thomas Jefferson University. He has research expertise in the adaptation of tissues to stress and overuse, specifically at the shoulder. He's a past president of the American Society of Shoulder and Elbow Therapists and a consultant for the Philadelphia Phillies and the Penn Throwing Clinic. So we're really happy to have him joining us today to be our speaker. And of course, we have back Dr. Fernando Santos. He's our host, and he's my partner in crime as a producer for this webinar series. He's a PhD and PT and our senior applied biomechanist at Bertec. So just a quick housekeeping point about this particular webinar. Dr. Thomas is going to present on the entire biomechanics of the whole pitch. So we didn't want to split it up into two different webinars, but because of that, it's a little longer than we typically run. So please don't hesitate to put any questions in the chat as they come to you while you're even watching the presentation, because we can address some of those questions throughout the presentation. And if you do have to bounce off at the end of the hour, feel free to do so and just watch the rest of the recording on our YouTube channel. But Dr. Thomas has generously offered to stay on for up to 30 minutes after to address any questions that we might have. So on that note, I'm going to drop off here and share my screen and play his presentation. So enjoy.
Hi, everyone. My name is Steve Thomas. I'm an associate professor and department chair in the Department of Exercise Science at Thomas Jefferson University in Philadelphia, Pennsylvania. So the title of the talk here is A Clinical Guide to Pitching Mechanics and Kinetic Chain Deficits, how to integrate both into a comprehensive program. So I'll be walking through pitching mechanics and how do we really kind of build out some of the kinetic chain aspects into correcting some of these mechanics that may be faulty. So I have no conflict of interest for this presentation. So when we look at pitching, Dr. Pappas was one of the first to really study pitching from a mechanics standpoint, and he described pitching as the most violent motion the human body could produce. And when you look at the biomechanics, it kind of makes sense. So it has been shown that the shoulder rotates at over 7,000 degrees per second. So just to put that in perspective for you, that's like the arm doing about 2360s in 1 second. So incredibly fast, violent. To show you how violent pitching can be, here's an old clip of Randy Johnson, and that bird was in the wrong place at the wrong time. So as we walk through this, what I'm going to be doing is essentially walking through the phases of pitching and identifying some of the biomechanical features that we see that should be occurring, but also the ones that we see kind of common faults in. So we'll walk through wind up, early cocking, late cocking, acceleration, deceleration, and follow through. So when I approach this, instead of saying specific biomechanical measurements or joint angles or things like that, I like to put it more in a perspective of a biomechanical goal. And because every pitcher is going to approach it slightly differently, and as long as they achieve that goal, then that's okay. It allows that each individual player to get to that goal and maybe a different path. So in the windup, what we try to look at is first, we want them to initiate the lower extremity. So we need that lower extremity to get moving. And that really kind of plays into what we look at the leg kick. So from a leg kick perspective, we're trying to get our center of mass higher. And as that center of mass comes up, so as we kick that leg, we get more potential energy. So the higher we raise our center of mass with that leg kick, we have more potential to create energy. Then you'll also see the pitcher will rotate towards his pelvis towards second base. And what this does is cause a pre-stretch of your hip external rotators. So we want this quick pre-stretch so we get this reflexive response, reflexive contraction, so we could explode later. We'll talk a little bit more about this in a minute. The next goal is energy generation. So this windup is really starting the process of creating energy with the ground. So another way we do that, we'll see a lateral trunk tilt. So that trunk tilt will help to load that back leg. So we'll put more of our center of mass through that back leg. We'll get that leg loaded so that we could cause a ground reaction force and move down the mound. And then last is maintaining balance, which is very, very important. And baseball players have a lot of issues with. And, you know, we want to align that lower extremity so we're in a nice balanced position. We want to have all of our joint works balanced. So, you know, we're not trying to make a lot of corrections to keep ourselves upright. We want it, you know, that nice balanced position without a whole lot of muscular influence. So we're just going to play this video here. So this is Chapman, and what you're going to look at, this is going to keep slowing down. So what you're going to look at is that pelvis rotating towards second. So he does a really good job at that. So his pelvis will rotate back towards second. You'll be able to see it here very well. There's that rotation right there. And then he's going to lean back right about there. So that is both that pelvic rotation and that lateral trunk lean. So Chapman doesn't get as much of a trunk lean as some other players, but he does a really good job at pre-stretching those hip external rotators, as you can see here. So he gets that quick pelvic rotation, causes the stretch, which will allow his pelvis to start explosively contracting down the mound. So in the windup, some of the common things that we see, probably the most common is balance, poor balance. So we see players have a really hard time balancing on that one leg. And when we think of pitching, that's a really important thing. They're on one leg all the time. So they go from one leg to the other leg. So you want to do a good injury history. So first thing that could happen is you could have chronic ankle instability. You could have previous injuries within your knee, ACL tears, MCL tears, things like that. So we want to try to rule that out from an injury history perspective. We want to make sure that that's not the underlying cause for their poor balance. What we also want to look at is they could have weak core and hip abductors. So that is a common cause for poor balance. So we could look into those causes to see if they're contributing to the poor balance that we see. And then last, we have poor energy generation. So for some reason, they're not really generating a lot of energy on that back leg. So they're not getting in a position to really load that back leg and get a good ground reaction force off the mound. And sometimes it's related to that poor balance. So when you have poor balance and you're using a lot of muscular contractions just to control your body center of mass, then all of that energy is getting placed into trying and fighting to maintain balance instead of generating energy down the mound. So those are the two kind of things we see from a common abnormality. The kinetic chain assessment now, to look for these things, right? We need to know how to look for them. So we could do a functional assessment. I usually try to start off with something functional, and the best one to do here is a single leg squat. And you can see this individual here. This is a baseball player that was having some shoulder and elbow pain, and this is bad. So he shouldn't be using his arm to lower himself on the table. He should be able to stand there independently and go down. His balance is so bad that he cannot get down there without balancing on the table. And you could see that kind of corkscrew effect as he goes down. His knee goes into valgus, his hip rotates. This is probably one of the worst single leg squats you'll see, but it really just serves the point of how easily this could come out. Very easy kinetic chain assessment to do. The other thing that's really good when you're working with athletes that are younger and their parents are in the room, this is a really good test to have the parents really buy into what you're trying to do and what you're showing them. when they see their son or daughter and they can't do this, it's very eye-opening that they could see what's going on here. We could also do isolated assessments. So we could look at hip abductor strength with the handheld dynamometer. So that's just a handheld device that will measure force. And that gives you a lot more accurate values of force. For core strength, I like to do a single leg bridge. And what I look for is I start them in a double leg bridge. So, lying supine on the table, your feet both flat on the floor with your knees bent, and you're going to lift your pelvis up, right? So you're going to get that bridge. You're going to hold it, and then you're going to transition into the single leg bridge. And this is where you really see when there's deficit. So the transition from the double to the single, you'll see shifting or dipping. The pelvis will drop. They should be able to maintain that position through that transition. So you want to be looking for those subtle little movements during the transition. And then lastly, we could look at range of motion to see if maybe they have some tightness issues, and that's why they're not rotating through their pelvis the way they should. So we could look at hip internal and external rotation range of motion. Moving on to the next phase, the early cocking. So the goals we're looking at here are to generate large amounts of energy. We're going to create momentum of the entire body. We want to make sure our lower and upper extremities are timed correctly. And then we're going to really position our stride legs so that we can maximize as much elastic energy as possible. And I'm going to go through detail on all of these. So a couple ways we're trying to create as much energy as possible on that stance leg. And the first one, again, is loading that back leg. So it really transitions and starts in that wind up, and it moves into this early cocking phase too. So the one aspect that you'll see here in this video is the center of mass lowering. So remember, in wind up, we were creating a leg kick and trying to get our center of mass essentially as high as we can. Here, now we're trying to lower our center mass. So we're taking that potential energy and turning it into kinetic. So you could see this individual, if you follow their belt buckle, you could see how much they drop their center of mass. That's creating kinetic energy. This also, going down into that squat or that lowering of center of mass, we're getting a pre-stretch to our ankle, knee, and hip extenders. And again, this is quick. This is a slow motion video. So this happens very quickly. So we get that stretch reflex going on. And in the next phase, you'll see we'll get an explosive contraction of all three of those extenders, the hip, knee, and ankle. The other important piece to this is our center of pressure. So we want our center of pressure as we're lowering to be through our heel. A lot of times, and we're going to talk about common deficits, but it will go up through their toes. So we want the center of pressure to stay through the heel and really sit back into that leg, right? So just like a traditional squat that we would teach these individuals how to do, we're going to sit, have a lot of motion through the hip and the knee and not as much through the ankle. And that's really getting your, loading through that heel. And when we do that, when we have the center of pressure through the heel, this allows us to push off the mound in the direction of what we call the drive line. So that's a straight line directly towards our target at home plate. And if we go and we put energy outside of that drive line, we're really wasting energy, right? We're putting it in a direction that the ball's not going. So that's not really helping us. So we always want to stay on that drive line, and by keeping our center of pressure over our heel will allow us to put all the energy in that direction. The common abnormalities we see here is that they're not loading their back leg. So you can see this individual here, they're almost at stride foot contact, right? They're about to contact, and they didn't lower that leg at all, right? They're in a very kind of upright vertical position. And, they're really not capitalizing on an area of energy creation that could really benefit them. So a couple of reasons why, we see this. So a lot of times it's weakness of either the glutes or the quads, or neuromuscular control deficits. So sometimes they have difficulty disassociating the quads and the the quads and the glutes. So they they just kind of co-contract because they don't know how to turn one on and the other off. So they co-contract and then they don't get any movement and they're very stiff through that leg. So, if it's a neuromuscular control issue, trying to get them to disassociate those muscles and go down through a nice controlled motion, or maybe it's just weakness in teaching, getting them stronger so that they could go into that position. But what this usually leads to is that you rely a lot on ankle motion. So when you're not moving through your knee and your hip because you're not, bringing that center of mass down and really keeping your center of pressure over your heel, you're going to force most of the motion through your ankle. When you force most of that motion through the ankle, what happens is that center of pressure moves from your heel up to your toe, right? It's the direction that it has to go, and that's what you're pushing. And that's when we see people in the gym that do a squat improperly. They put all of their weight up through their toes, right? And they get a whole lot of ankle motion, and that's when our knee kind of goes in front of our toes. So the same thing kind of happens here. Is we want to keep that weight through the heel. And when we do that, when the center of pressure goes up to the toes, we don't have much ankle motion to begin with. So if we're tight in the ankle, we go up through the toe, we're really going to push off early in addition. And then we're going to push off in a direction that sends us off the drive line, and we're going to be in a very closed off position. And then we're going to have a hard time redirecting ourselves back over to the left for a right-handed pitcher as we get into the later phases of the throw. So how do we look for this from a kinetic change standpoint? So one, our functional assessment, we could do a single leg squat too. So we want to see if they could really sit down into that leg, right? Keep their center of pressure over their heel and really get a good mobility through that leg. We could also look at some isolated assessments. So looking at knee extension and hip flexion strength. All right, so if we think it's a weakness issue, we could use an HHD to measure how strong they are in their quads and their glutes. And then we could look at ankle dorsiflexion. So sometimes just being very tight in our ankle will affect how we could squat down. We know, Achilles tightness and things like that because of heel lifts in most shoes that we wear could be a factor. So we could look at ankle dorsiflexion. A little more of a functional test is a lunge. So you can see that here. So we're going to take the width of the foot away from the wall, keep our heel nice flat on the floor, and we're going to go down until our knee hits the wall, and we can measure this angle of our shin. That angle in normal cases should be greater than 35 degrees. If it's less than that, it seems to, it's typically restricted ankle dorsiflexion range of motion. And this is a little more functional from, the position that you're actually in when you're pitching. But you could look at isolated range of motion within that ankle as well. So the next goal of this phase is creating momentum of the entire body, right? So when we talk about momentum, every coach in the world talks about getting your momentum going and things like that, but not too many people know the equation for it. And it's a very simple equation. So it's just mass times velocity. But I think knowing that equation helps us know how to manipulate it. So when we're getting our momentum going, one way we want to do that is that triple extension. So in the previous goal, we talked about lowering our center of mass, getting a pre-stretch in our hip, knee, and our ankle. Now, when we get that quick pre-stretch, we get a reflexive, explosive contraction of our hip, knee, and ankle if we do it correctly. That's not a voluntary contraction, right? A stretch reflex is involuntary. It's fast. There's no delay in it, and it's very explosive. And this will start to generate that momentum down the mound. You also might have heard of the term mass is gas, and it's really true. So because this equation has mass in it, the bigger you are, the faster you likely will throw. All right. So individuals that have a lot of body mass tend to have higher ball velocities. If you look at CC Sabathia, who, he's easily weighed over 250 pounds most of his career, throws the ball really hard. And there's one spring training showed up to camp a lot lighter, lost a lot of weight. And his fastball was lower than previous years. So, we do see this, that individuals are just bigger pitchers. They're the ones that end up throwing harder. And it's interesting that body composition doesn't really matter. So we don't really see, it's that these athletes have to be more muscular, because the equation doesn't take into consideration. Mass is mass, right? So it doesn't matter if it's muscle or fat, right? That will lead to more momentum creation. And really the common abnormalities we see here is just that poor triple extension. So either we had an issue in the previous phase where we didn't get that pre-stretch, and we're not getting now this explosive contraction. And what's going to happen here really is that our muscles that are higher up the chain, more proximal into our arm, they're the ones that are going to try to make up for that lack of momentum creation through the legs. So they'll kind of try to catch up, or they'll try to do a little bit more than they normally do. And that over time will not lead to good things. So that's where we get into our overuse kind of issues. So the next one of the early cocking phase is properly timing our lower body and our upper body. So I look at this as your lower half and your upper half are doing two independent things. And as you stride out, the distance that you're able to stride out really is buying you time, right? Buying your upper extremity time to get your arm in the right position, right? Because once you have stride foot contact, once that front foot hits, the wave of energy is traveling up your chain, whether your arm's in the right position or not. So we want to make sure that we stride far enough, not only to generate energy, but also to make sure that our arm has gotten in the spot that we want it to. And we're going to talk about that in a minute. So really the biggest factor here is stride length. And if you want to change any biomechanical variable in a pitcher and have the biggest impact, I truly believe that it is stride length. It should be at a minimum 85% of a pitcher's height. You'll see commonly it's more than that. And Tim Lincecum here he probably had one of the best stride lengths out there. So this, like I said, times you properly, but it also allows you to create force over a greater distance or amount of time. So, the longer that back leg is pushing off the mound, essentially, right? The bigger your stride length is, the more time you allow for force generation and acceleration of your mass. This also gives you, like I said, the time. So you want your arm, your shoulder, to be in about 60 to 90 degrees of external rotation at foot contact. You can see Tim here is not at stride foot contact yet, and his arm's not in the best spot, but by the time he gets here, his arm should be up about 60 to 90 degrees, somewhere between here and here. And that's where we want it to be. This long stride length also will pre-stretch our hip and core muscles. So you can see as Tim is striding out here, his hip musculature is going through a dramatic stretch. And then, as his pelvis begins to face home plate, he's going to get stretched through his core muscles too. Research has shown that, with a very adequate stride length or a longer stride length, that the follow-through phase, you have less forces on your posterior shoulder. So when we look at the forces of pitching, after ball release, the largest forces at any aspect of the pitch is actually the distraction force. So the force holding your arm on, right? So the force trying to keep your shoulder connected and not flying down the mound with the ball. That's over 1,000 newtons of force. And, when you stride out further, that force gets reduced. So that's a very good thing, because that force creates adaptations within our shoulder that tend to be bad. So a further stride allows us to really dissipate forces better too. And one of my mentors, Jeff Cooper, who's an athletic trainer with the Phillies for over 30 some years, he taught me that you don't need sophisticated motion analysis and software programs to measure stride length. All you got to do is look at the footprints in the dirt, right? So a very low tech, simple way is they're going to leave marks in the dirt where they're landing, and you could simply measure it that way. So, a very clinically relevant thing to measure in players. So the common abnormalities really are just a short stride. But why? What's the underlying reason of why are they striding short? And I think it's one of two things. So it's could be lower extremity weakness, kind of like what we said about before. And that could be from the glutes or the quads. So really it's in that stride foot contact, right? Not the push off leg, the stride foot leg. When that foot contacts, it's a huge impact force. And if your lower extremity is weak, so your quads and your glutes are weak, you're not going to be able to absorb that impact in a stiff manner. So what we want to do is land very stiff, and you won't have the strength to do that, because the further you stride, the bigger these moment arms are, and the harder it is to maintain that stiff landing. So what you'll end up seeing is as they stride, if they do stride far, fairly far, you'll see a soft landing. So like this picture here, he's really sunken into that knee and that hip, right? So he should be up here more at a more diagonal, about 30 degrees of knee flexion roughly at the most. He contacted and sunk in, and that's a big sign that there's probably some kind of weakness going on there. The other factor could be limited range of motion. So if our stride legs hamstrings are tight, so this leg hamstrings, or this back leg hip flexors are tight, that could limit how far we could stride out. So, you could tell an individual stride further, but if they have a weakness issue or a range of motion issue, it's not going to help, right? There's something underlying, that's causing this limited stride length. So we have to address these things. So how do we look for these? We could look functionally. So we could have them just do a forward lunge, but put tape down to 85% of their height and really see how they do it. So if they can't get out there, it's likely a range of motion issue. If they can get out there, but they can't control it, right? So if you have them go up and down through a lunge and they really don't have the strength to control it, then it's likely a strength deficit. We could do more isolated to get really specific. We could look at the strength of the quads and the hip extenders. But then we could look at the flexibility of the hamstrings with just a straight leg raise, or using the Thomas test to look for hip flexor tightness. And you can see that here on the right. So, if this leg rises when I pull this one up, that means this hip flexor is kind of tight. If the knee extends, that means the quads are tight. So we can look at a combination of the two to see if there's some tightness issues. All right, now moving on to the next phase, the late cocking phase. And we have a couple different goals here. So absorbing that, having a very stiff impact with that stride foot to absorb forces. And then we want to pre-stretch our abdominal muscles. We want to properly position our upper extremity. We touched on it a little bit. We're going to get in more detail now. And then we're also going to pre-stretch our shoulder internal rotators. So these are the goals that we look at. So here, this stiff landing. So when I stride out and my foot contacts, right, I talked about it needs to be stiff. There shouldn't be any motion through your knee or your hip. And the reason for that being is this cartoon, I think, depicts it very well. So we could think of us going down the mound right before front foot contact, like us riding in this motorcycle, right? And we have to think back to linear momentum equation, mass times velocity. So we have a certain momentum going down the road. We're going to hit into this wall, right? So when we ride the bike into the wall, what's going to happen is the bike's going to smash in and the bike will stay. And then we're going to get sent flying over this wall. And the reason that happens is because of linear momentum, right? We have a certain mass and a certain velocity. The wall stopped the momentum of the bike, but then it transferred it up to us. And the reason we're going to fly even faster than the bike was flying was because we're taking away the mass of the bike now. So if we look at this equation, if this mass goes down, right, and we're maintaining our momentum, the conservation of momentum, it doesn't change, right? It just gets transferred. So if our mass goes down and this is staying the same, our velocity has to go up. So now we're going to be flying faster. Same thing with pitching. So when we have a nice stiff landing, right, and we have co-contraction at our knee and our hip, and we impact that force, we're going to, instead of absorbing that energy, we're going to send it up the chain. And now we're taking out our lower half mass. So the upper half mass is going to be at a higher velocity because we took that lower half mass out of the equation now, right? So the energy is moving up. Kind of the same phenomenon as a whip. Big mass in the handle, and as the whip goes out, it gets thinner and thinner and thinner. So you create a wave of energy through the handle, and it gets propagated down to lesser and lesser mass. And as that happens, the wave of velocity just keeps getting bigger and bigger until it snaps with very, very high velocity at that. So same kind of idea. So what we commonly see is that we see this collapse. So when they impact, you'll see them sink in. We don't want to see sinking. They should land very, very stiff. Or we see their pelvis tip or rotate or do something else as well. The next is that pre-stretch of your abdominal muscles. So this is what you hear of as hip trunk separation. Here's Tim Winston again because he does a phenomenal job at this. And so after that front foot contact, what's really happening is you're getting an impulse force, right? Huge force right through your lower extremity, through your femur, and your femur is connected to your pelvis. So as soon as this leg hits and your pelvis is like this, let's say the force is going through this leg, it's going to push that pelvis back, right? And what's going to happen is it's going to create a rotation in your pelvis so that your pelvis starts to turn towards home plate, right? Right before this was more in line with the trunk. This hits and it starts engaging that rotation of the pelvis forward. So what should happen is that our trunk and arms should not move. It should stay back where it is here. And this is what causes that pre-stretch of your abdominals. Your pelvis starts to rotate, but your trunk doesn't move. And you could see the rotation through his shirt, right? This is the same kind of pre-stretch as happening through his abdominal muscles. All right, so his shirt kind of mimics what his abdominal muscles are doing. And you get that quick stretch, and then now you're going to get an explosive stretch reflex reaction. And that is really what gets you into what we call layback. So that position of max external rotation. This is not an active thing. We're not using our external rotators to get us to this position. We're using momentum. All right, so when this happens, right after that explosive contraction of the trunk, our trunk's going to start to rotate around. And that velocity that we're creating through the trunk that's going to force our shoulder to get back into lay cocking. No different than if you're in a race car and you slam on the gas, what happens? You get pushed back into your seat, right? So the same thing is happening here. Our trunk is stepping on the gas and it's pushing our arm back, right? So this is a passive movement. That's the way it should be. If we have to use our external rotators to get us back there, we're not going to get back as far. And we're not, we're going to fatigue out those external rotators because we're asking them to do another job that they're not supposed to. We're going to talk a little bit more about that as well. And then the other thing that we do here is this lateral trunk tilt. So you can see how much he's tilted to the trunk laterally here. And the reason what this does is it reduces our moment of inertia. So what our moment of inertia is essentially the resistance to rotational motion. So how this happens is by tilting, right? We're tightening in where our mass is around the axis of rotation. All right, so by having this trunk tilt, we're directing more mass closer to that axis of rotation through our spine, as opposed to if we were out here. Right, we're tilting, we're bringing our mass in a little tighter. And the best way to think about this is a figure skater when they're doing spins, right? They start with their arms out, and then they bring their arms in tight, right? And they just automatically start spinning faster because you're taking away resistance to rotational motion. You're pulling all of that mass in close to the axis, which ups our velocity. Same thing happened here. So the abnormalities that we see here are that the trunk and the pelvis will stay together. And we see this really commonly in young kids. They don't have the neuromuscular control yet to really disassociate their pelvis and their trunk. And you can see that here, right? This kid, likely is going to land with the foot, and the pelvis and the trunk are going to move like you have a rod right through them and they're connected. Right? That's not what we want. We want the pelvis to disassociate. So it's really a neuromuscular control issue. And we just need to work on having them contract and move their pelvis without their trunk moving. We're going to talk about that in a bit. It's also going to get their arm kind of moving a little earlier. So if they're not disassociating, they're going to get their arm kind of going earlier to try to make up for it. And again, that's going to get your arm out in front a little bit. You're going to utilize the arm more for energy development standpoint. The other thing that we see here is, really the arm is not in the correct position. So when our stride foot contacts and we have that big impact and we get hip trunk separation, right? If we start to rotate the trunk and the arm is down here in the internal rotation and not up into 60 to 90 degrees, what's going to happen is our trunk's going to rotate still anyway, and now momentum is going to push our arm into internal rotation. So our external rotators are going to have to fight that momentum and actively get into layback, right? We said before, we don't want them to actively get there. That should be a passive positioning through momentum. So if they have to fight the momentum and get back there, we're really asking the cuff to do a lot. And this is kind of that inverted W that you hear about. So I don't agree with that position. I think it's making your rotator cuff do a lot more work. It also has been shown to increase torques on your shoulder and your elbow. And it's going to lead to early fatigue. Those two external rotators are small muscles, and they're really the brakes. So they're the things slowing down your arm after ball release. If they have to get your arm in the right position too, you're asking them to do way too much. So from a kinetic chain assessment here, we really want to make sure that you could disassociate your pelvis from your trunk. So Titleist Performance Institute has created this, and this is a common thing in golfers too. Golfers, hitters, everybody needs to be able to disassociate their pelvis and their trunk, and that's in all these sports. This is where energy creation comes from, a big part of it. So they have this disassociation test. So essentially you're going to stand here, you're going to cross your arms, and you're going to keep your trunk stationary while you rotate back and forth through your pelvis, right? And that's really the test. Can you do that, right? And I have this video here. So that's what we want, right? We want to be able to move our pelvis and not have our trunk move. So you could have a good time trying to train your pitchers and show them that video and have them replicate it. But it's also, essentially the test is how you're going to work on it, right? So you're going to do that same type of exercise, really trying to get independent control of those things. We could also look and see if there's any range of motion issues here. So isolated assessments would look at trunk range of motion or hip range of motion. So you could take images. So downspring training with the Phillies every year, we take these images on an iPad. We use the line bod here just as a frame of reference, but we have them rotate one direction and then rotate the other. And you can see there's a deficit there, right? They can rotate way better to the left than they can the right. And we don't have direct measures on these, but we could see that there's deficits when they happen. And if we measure them over time, we could see if things are changing. We could compare preseason to midseason to postseason, and we could see, is it getting worse? Is it getting better? So even without objective measures, you could see these things. The trunk, you could also have them seated if you truly want to isolate it and have them rotate. This is a combination really of the pelvis and the trunk. But you could look at things of the feet too, right? So is the foot pronating when they're rotating, or is it not? Or, all these features throughout the chain. And that's really how they're going to function when they're on the mount. They're going to utilize their whole body to get rotation. And then you could look at hip range of motion again, like we said in previous sections. So with acceleration, really the goal here is to get your forearm moving with maximal acceleration of velocity. And you can see Verlander here. This is incredibly in slow motion. And you could see that phase from late cocking to acceleration, you'll see in a second. It's like the blink of an eye, even in slow motion, right? So there's not a whole lot we could do here. Really, we hope that we did everything right up until this point so that right there to there, see that split second? Everything is in line, and he's going to release the ball at a high velocity, and it's going to be effective, right? So really, you can look at these kinematics and forces. These are, stand, but we hope that we controlled everything up until this point, because at this point, we can't do a whole lot. It's too fast to really cause any change just by focusing in on this area. But we will look at some common abnormalities. So one is a decreased shoulder abduction. Sometimes this could be due to pain. So, a lot of times when people have shoulder pain, when they get to 90 degrees of abduction, they will drop because it hurts, right? And essentially, whether you're fatigued or it's painful, right, you're going to go to a place that's not. So the way I think about this is if my supraspinatus tendon is inflamed and painful and irritated, this is the biggest moment arm that my shoulder's fighting to keep up, right? So my muscles are working the hardest here to overcome a resistance moment arm. And what's going to happen is that's going to create the most tension within my tendon and my muscle. So if it hurts or I'm fatigued, I'm going to lower, creating a smaller moment arm, right? And that's going to take away the tension within that muscle and maybe some of the pain. So that's why I think we see this decreased abduction is more of a compensation to get away from this very large moment arm. Sometimes you'll see decreased external rotation. So when we look at this, these individuals get in a pretty far layback. And if they're not, right, it could be one of two things. There's a bony adaptation called humeral retroversion, which is when your growth plates are open as a kid, it's how much your humerus is rotated. So if you get a lot of retroversion, you get back further and you lose internal. So, but you get this position of external through a bony standpoint, and that could be beneficial. If you see limited external rotation, it could also be that your internal rotator muscles are tight. That's an area that we don't stretch that often because we think individuals have instability within their shoulder. So we don't want to overstretch them or create instability. But, really, the fact of the matter is that these are big, powerful muscles and they do get tight sometimes. We also will see individuals throw out of the scapular plane. So if we look up here, this position of A is the scapular plane. It's about 30 degrees anterior to the frontal plane, and that's where individuals should be throwing. If they throw out of the scapular plane, it looks like this. And typically, they will throw out of the scapular plane for one of two reasons. Sometimes, if they don't have enough external rotation, they'll come out of the scapular plane to try to get more. But then also, if you have a tight posterior shoulder, that will relieve tension on your posterior shoulder by coming out of the scapular plane, and that would be a little more comfortable for you in some situations. It could also mean that you're striding off the drive line. So if your pelvis opens excessively early, so before stride foot contact, and you get off the drive line, now your shoulder is going to lag behind, and the rotation here is going to kind of force it out of that scapular plane. And then the last thing that we see that, for me I even see it in major league pitchers, is that knee extension is occurring after the ball is released. So you can see in this individual down here, the video's been playing for a little bit. He has a lot of bad mechanics going on that we could talk about here, but just watch, he's one that will sink. Watch him sink into this leg. So at ball release, most of his mass is towards his butt, right? And it's fighting the momentum of his upper half. So they're in this tug of war. So he's really losing out on a lot of momentum down the mound because his back half is going, stuck this way and his upper half's trying to go that way. You want all of this mass to be going together. But his knee never goes into extension. You can see it should go into extension right before ball release and give a little catapult to the ball. But you can see he sinks in that knee and he never gets out of it. So that's a big problem. So from a pain standpoint, if you have decreased abduction, you can look at injury history first. Do you have a history of shoulder injuries? Do you have pain? We could do things like the scapular assistance or reposition tests, which are here. So we could help the scapula out to see if that takes the pain away. If it does, then the scapula is involved in those symptoms, and we could address that in a rehab standpoint. We could also look at shoulder strength. A lot of these players are very weak on their dominant arm, which you wouldn't think they would be. They're throwing a ball at over 90 miles an hour. You think that arm would be very strong. It's actually the opposite. It's usually weaker than the other arm. We could also look at range of motion of the shoulder. And I take it further than just internal and external rotation often. So I'll look at internal rotation, but I'll also look at different forms of external to try to pin down to see if certain of the internal rotator muscles are tight. So I usually stabilize the scapula. This is just for picture's sake. I wasn't able to have somebody there stabilizing it. So I want the scapula not to move, but I'll move them and I'll look at external rotation. Then I'll put them in a sleeper position, so lying on the side here, and move them into external. If external rotation is less in this position than the supine position, as you see here, I would say that is teres major tightness, because the teres major is a posterior muscle that comes around the front and connects anterior. So if you go and cross adduction, you're putting the teres major under more tension, and if it is already tight, it's going to limit how much you could rotate into external. So that's my way of isolating the teres major. For isolating the subscap, I could look at abduction at 0 degrees of abduction, like down here. And then for the lats, which is another big internal rotator, you can look at the supine flexion. So just moving up into flexion, you have to watch is the compensation. They're going to arch their back. So if their lat is tight, their back will arch. So what I usually do is put my hand under their lower back, have them contract their abs so that they're pushing down against my hand, and then move up through flexion. And if you see deficits there, then it could be your lats. So the last phase here is the follow through the deceleration. And the goal here is now you created all this huge amounts of energy. Now you got to absorb it. All right. So the same principles pertain to absorbing energy. We want it to be a whole body process. But we talked about that knee extension. So this is Aaron Hicks. Watch his knee extend. It's like this catapult right at ball release. And he throws, I think a couple games ago, he's hit 103. So he throws incredibly fast. So he gets that knee extension right at ball release. He times it perfectly. But at this phase, you can see the loads on the shoulder and elbow are very, very high. And they're the loads fighting the arm from going to home plate with the ball. The way that I think about, absorbing this energy is incorporating the whole body. So there's a biomechanical equation called impulse momentum. So it's a little scary, I know, but it's not that difficult. Let's just walk through it. So we have linear momentum, which is mass times velocity. So what we have here is our final momentum minus our initial momentum. So momentum 2 minus momentum 1. And this is our change in momentum. So with deceleration, we don't have a choice at the final. The final has to be 0. We have to come to a stop. We also really don't have much control over 1 because we're trying to create as much momentum as we can, right? So this part of the equation, we don't manipulate, right? We have to come to a stop. We come over on the other side. So we have force and we have time. So we could choose to get that change in momentum over a large period of time, over a lot of joints, or a short period of time, right? And the difference is, if time is large, force will be low. If time is small, force is going to be high. So if we only use a couple joints to dissipate it, we're going to have high forces through those joints. All right. So what we want to do is utilize the whole body, have a big follow through step like Hicks does here, and really let all the joints absorb a lot of that energy. So the common abnormalities is really no follow through step. So if we think back to that kid that was, sunken into his knee and his hip, his butt was staying back, he didn't follow through at all, right? He didn't have a follow through step. He was sunk into that hip and that knee, and his lower momentum stopped. So his lower half wasn't doing anything to absorb energy. I guarantee his distraction force at his shoulder was through the roof. You'll also see people will stiffen up their arm after ball release, and this is kind of what we see in this kid in this video here. He kind of pulls his arm back after he releases it, and that again is a bad strategy because he's not, he's trying to absorb everything just through his arm, and you can tell his follow through step is very short, very small follow through step. You could also have limited stride hip internal rotation. So as we're rotating through, we should be rotating over our stride leg and our hips. So it means we're going into hip internal rotation to dissipate energy. A lot of throwers will get tightness in that hip. They won't be able to rotate through. So the less motion they have to rotate through, the less time that you have to absorb some of that energy. So look for that lack of hip internal rotation on the stride leg. Players will also tell you, say they're a right-handed pitcher, they'll say, I have a hard time hitting that outside corner to a righty because they can't get their body over to that spot, right, to really work the corner because of how limited their internal rotation in their hip is sometimes. So check that out, ask that question, and it will lead you to that. Also, having limited shoulder internal rotation will put more stress on your shoulder. So we've found previously that those that have more humeral retroversion, which is good for getting back, but now you have less runway to slow down through your shoulder, that creates more of a thick posterior capsule, so more stress on the posterior shoulder. And then just lastly, looking at the scapula. So if we have, we run out of room in internal rotation on the shoulder, what really happens is it's going to progress up. And look at this high-speed video. Right when he gets into max internal, you could see his medial board of his scapula kicks up. See that? See it kick up? And that's essentially all the slack is taken out of the capsule and out of the shoulder, and now it's going to get propagated out to the scapula. So now you're forcing these scapular muscles to get this kind of eccentrically high load, high velocity, and that's not good for those muscles. All right, so we see a lot of kind of issues there too. From a kinetic change standpoint, we can look at going to humeral range of motion, make sure they have adequate internal rotation and horizontal adduction. If we have ultrasound, we can look at how much retroversion they have and get a better sense of that. We also want to look at their scapular control. Do they have good, are their scapular stabilizers strong and stable to prevent that scapula from kicking out? So what I like to do is just a forward flexion with weights. So they're just going to move through about 20 reps with 5 pounds, and you're going to look at their scapulas. If they're juddering, if they're kicking out at the end like this individual is, that's a sign that their muscles aren't quite strong as they need to be a pitcher. All right, so you could focus on that. You could also do what's called a posterior shoulder endurance test, and this is where you're prone on the table on your belly, and you're going to basically hold your arms out like Superman, like a Y position, and you're going to hold them isometrically, and then you're going to record how long you could hold that position. And that's a good metric for how much endurance those muscles have. They should be both strong, but also have endurance. And again, looking at hip internal rotation, especially on that stride leg, will be important. So just in conclusion, to wrap it up, we want to focus on the lower extremity mechanics. These are the ones that we really have big impact over. right? We could use the dirt like Jeff Cooper taught me. But these are what gives you the most bang for your buck. Trying to affect the upper extremity is difficult. At that point, hopefully you did everything right on the lower half. Use video to help assess. So yeah, motion capture systems and everything else are fantastic, but our iPhones now have 240 frames per second. We could use that video to try to get a good sense of what's going on, right? We don't need full-blown 3D mechanics all the time. But always make sure you align your videos correctly. It should always be perpendicular to the plane of motion. So if you're looking from the side, be perpendicular. If you're looking from the back, again, be very perpendicular, because if you're off angle there's a lot of deceptions that could go on with you thinking what angle a certain joint is in, and it's just deceptive. So always be perpendicular. Identify those abnormalities. Look at the kinetic chain, really see what's going on, get to the root cause here. That's really what you want to do. And because you're not going to change their mechanics until you really get to that root cause of why they have those altered mechanics, right? And use corrective exercises to address them, and then continue to address them. Because if you're a pitcher and that's how you broke down once, you stop doing those exercises, you're going to break down the same way again, right? So just keep focusing on that. So I'll just end with some funny pitching mechanics here. So if you're able to pitch like this, you'll probably get everybody out. All right. Thank you for your time. And I'd be more than happy to take any questions that you may have. Thanks.
Okay, you're back. Great. Okay, thank you so much for that. We still have a lot of people with us, and we can go a little bit over. So for those of you who have to drop off, that's totally okay. You can watch the video later on YouTube at Bertec HQ. But Dr. Santos, why don't you kick off with a few questions, and then there are also some more in the chat.
So if you have, let me just, I have two screens here and I got a little bit lost, sorry. So if you find several mechanical flaws, how would you approach that picture?
Well, that's a great question, Fernando. And for those that don't know, Fernando is actually my TA at Temple University in biomechanics. But so yeah, I would kind of start with probably the easiest one to fix. So try to prioritize it into what do you think is going to what change can you make in that athlete the easiest and the quickest, and start with that one. I would avoid trying to change multiple things at once, because I think it's very hard to get that to stick. So have them really work on one issue that you see, correct that issue, really see that change in neuromuscular control if it's related to that, really kind of stick and get comfortable, right? So they could do it for you, and they could do it a couple times on the mound, but when they get in a game situation, sometimes that goes away and they go back to the old activity, right? So trying to pick and identify which one you think is going to be the quickest change, get that to stick, and then add on others after.
Really good. And what is the biggest aspect of pitching that is out of your control?
The one that's out of my control?
Out of our control, yes.
Out of our control? That's a good question. I mean, really what's happening, at that acceleration, we can't, I think, when you think about looking at that from a kinematic standpoint and kinetics, valgus stress and those types of things, the only way we really have effect on that is changing things prior to that, right? So, there's not much I don't think we could do with the arm to try to correct anything that, so say, oh, well, your elbow needs to be in more flexion or extension during this acceleration. You're not going to teach a kid necessarily to do that, I don't think. I think it's more of addressing the earlier things and hope that, that that propagates out to that phase.
Really good. I have to say that I was really happy looking at the chat and seeing how many questions were there and all the conversation and everything. I think that was really good. Is there any question there that you want to go a little bit farther, that you want to comment, or something that you want to talk a little bit more?
Yeah, I'll just work back to the ones I didn't hit. So Colin asked a question about, with the high forces getting dispersed throughout the scap, does that make them prone to injuries? So one thing it definitely does is it will affect your adaptation. So you could have very negative adaptations like posterior shoulder tightness, neuromuscular control issues within your scapula. Those types of things that we know will have a negative consequence on the health of your shoulder. But there is one injury in particular that is somewhat new. Dr. Kibler has really published on this and talked about it. So it's called scapular muscle detachment. So it's either the rhomboids or the trap often will detach from its insertion site on the scapula. And these are injuries that you'll see a lot in kind of car accidents and things like that. It's a high impact, high velocity thing. So, you'll see it in car accidents because you're holding on a steering wheel and you get rear-ended and you get that very high explosive contraction in your scap muscles causes the tear. But he has seen it in quite a few throwers as well, and softball players too. So, and it's something that gets undiagnosed for a really long time. So that, in the general population, this injury will go undiagnosed for over a decade. These patients will see over a dozen doctors, have multiple surgeries without any resolution of symptoms. So, it's a really interesting kind of injury. It requires surgery, obviously, to reattach that muscle. But there's some long-term effects, especially the longer it goes misdiagnosed. So that's definitely something that could happen. It's definitely on the more dramatic side. You don't see it in, obviously, the major leagues talked about, but on some lower level throwers, it has kind of come out.
We still have questions coming up, so
Yeah, I'll keep going.
So Jordan, our last question that I see right there. At what point do you leave bad mechanics alone, for instance? So I'll let you go and read. It'll be easier.
At what point do you leave bad mechanics alone? For instance, it causes a regression in reduced vertical brake or specific metrics, which can result in lessened swing, missed lowering in gear. I mean, that's a tough question. So, a lot of, for me, there are aspects to the pitch that do affect performance for sure. I think a lot of kind of the brake and horizontal movement, some of that will be affected by trunk positioning. But as a pitcher, you want to present yourself almost exactly the same every pitch, no matter what you're throwing, so the hitter doesn't have any cues. So if you're not altering any of your really body mechanics to be deceptive, then really what the changes in the pitch come from and the movement is really finger movement, right? So how you're putting pressure on the ball and how you're affecting spin or rotation with your fingers and your hand placements. So I would probably try to lean towards that more if you're having issues with brake and things like that. You can make up for some of it with positioning your body, but I think that's not the right avenue to go down. So getting some of these high motion videos, if you have access, or Rapsodo, things like that, to really monitor what you're doing from that, the flight of the ball. So that's kind of a whole different biomechanic talk, right? Is what the ball does and how you influence the ball after. This is really, trying to get your body in the right position, throw the ball as hard as you can. And hopefully, the other piece of how you're placing your fingers will also fall in line too.
Really good. I think we went to almost all the questions there, or if not all the questions during our chat is already.
One from Joshua about joint forces in the hips during deceleration, and nobody's looked at that. So there's there's a technique in biomechanics called induced acceleration analysis. So it essentially tries to look at, the effect on the acceleration due to each individual joint torque. So, essentially you're going to take out all the other joint torques and just add that one back in and see how it influences some outcome, like ball velocity or distal hand velocity or something like that, or the acceleration. So those studies have been done. I would like to see the opposite done, an induced deceleration analysis to see how each joint is contributing to the deceleration of the body. So that has not been done, but hopefully somebody will take on that task one day. It's a little tricky from a biomechanical perspective, but it would be very helpful, I agree, of trying to understand what's the best method to really absorb, dissipate that energy over all the joints, and what are the forces at the joints during deceleration. We know what they are, basically up until the point the ball comes out. We know the distraction force in the shoulder, but we don't really know, what's going on with the other joints.
Pretty good. Anything else you would like to say? Anything else that you'd like to go more in depth, or we're good?
Yeah, I'm fine. I'd be happy to answer more questions if they come in, and hopefully you all learned something from it. I was able to give you something to take back and help some kids so that they stay a little healthier while they enjoy the sport that they love. And that's why I do this, is I love the sport of baseball. It really has affected my life. So I think trying to keep these kids healthy and playing and doing what they love is what I try to do with my research and giving these presentations.
Yeah, most definitely. The shoulder mechanics, and it's so complex, and there's so many injuries that you can have, and so there's so many things that can happen there. At least to me, and I'm seeing like so many people in our webinar today. It's always good to listen. It's always good to learn more and practice and have these conversations. That's the only way for us to get better. It's really good.
Yeah, and I'm learning every day too.
Yeah.
And in 10 years, I'll probably say, what was I talking about then? It's an evolving thing, and we're always figuring things out and learning more. But it's trying to integrate all the research, all the knowledge you could grasp from like a pitching coach and those individuals. We all have different takes on things, and I think it's us collectively working together that's really going to get to the right answers. And I think the challenge there is that we all have to speak the same language. So as a biomechanist, we talk much different. If we talk to a pitching coach, they're not going to know what we're talking about, and we're not going to know what the pitching coach is talking about. So trying to come together and figure out, the language we use and how we could really communicate and work together is important.
You just hit the nail on the head with the philosophy of this webinar series too. We want to try to bring everyone together into a mutual conversation. I did see another question that was really good in the chat. Sung Kim asked, what are the most common functional assessments you often use? Do you want to take that one?
Yeah, so, I think the biggest one is that single leg squat for a baseball player. They have to be able to maintain balance. They have to be able to do that correctly. And that's usually the easiest giveaway that they have some lower extremity issues or core issues that have to be looked at further in more detail and addressed. So if I have to say, kind of give one, that's honestly the biggest one. But just kind of that transition from a double to a single leg bridge is a good functional test. I know the core is a little tricky to evaluate, and I think that's one of the best ones out there. So that I try to keep things as simple as possible. I don't, you could do FMS, you could do some of these other certifications that are out there, and I think they're great. They do take time, and they take skill and expertise to do them. So, I try to keep it as simple as I can, just so that it's kind of more powerful and more people could use it.
Excellent. We have another question from Robert Baker. Is muscle power a more important measure than strength in shoulder or hip when assessing for injury prevention or for performance?
Yeah, that's a great question. I think, you have to have both, because this stuff is happening so fast, right? We slow it down and it looks not as fast, but, when we talk about, that individual that's sunk into their hip and they couldn't get back out, right? That's power, right? You have to have power in your quad and your glutes to be able to pop through, right? So as soon as your foot hits, that should be your cue where those muscles powerfully contract and explode you through like Hicks does. So I think power is just as important as strength. So yeah, I think you really have to address both from a training perspective. So, working both of those areas, absolute strength, but also working in that explosive capacity, especially from a lower extremity. Yeah, I think it's useful in the upper extremity at times, but the lower extremity is going to be where it's going to carry over the most, I think.
Great. If you have another minute, he added a layer to the question. Are there any accelerometers that can be used to assess acceleration, trunk and arm, or deceleration?
I don't know of any per se. I know there's some IMUs out there that some individuals use to try to get some kinematics and get some information. I haven't used any personally, so I can't say one way or the other, what's good, what's bad. I know the IMUs, definitely from a research perspective, they're really not there. From a clinical kind of coaching perspective, I think they're okay. Yeah, they give you some information to help guide, but yeah, I think there's still a lot of growth in that area, just from hardware, software perspective that I think is going to get better in the next decade or so, but they're still not fantastic.
Great. Okay, I think with that question, we'll wrap it up with you and let you get back to your busy days. So thank you everyone for joining us. I wanted to let you know what's coming up next in the lineup of the webinar series. But first, a huge thank you to Dr. Thomas for your time and generosity with sharing your presentation. We had a great turnout and some really great questions in the chat this time and afterwards. So I think it's wonderful that people are participating in this way and asking questions and getting their answers so they can apply them. And thank you to Dr. Santos again for being an excellent co-host. And so you can also, by the way, follow Dr. Thomas on Twitter at shoulder_nerd. So definitely follow him on there. You'll get a lot of great nuggets. Okay.
Thank you for hosting and putting this on. It was fantastic. And thanks for everybody attending. And feel free to reach out to me, email me directly if you have any more questions.
Great. Maybe you can pop your email in the chat there if you haven't already while I.
Sure, yeah.
Okay, so the next webinar we always host these at 3 p.m. Eastern time on Wednesdays, and we'll continue to do that. So the next one is on May 12th at 3 p.m. Eastern time with brain health coach Ryan Glatt, and he'll be presenting on your brain on exercise. So that'll be really applicable and very interesting. And then on the 19th of May, we have Dr. Charles Shearer, joining us again to present on VOR exercises from an eye doctor's perspective. He's our neuro-optometrist at Bertec. So thank you so much again. Please subscribe to the Bertec HQ YouTube channel where you can find all the recordings from these webinars. And if you had to pop off early, you can always find it there. And you can follow us on all the major social platforms at Bertec HQ. So thank you all so much for joining us, and we'll see you next time. And we really appreciate your time. Thanks. Bye-bye.
Thank you. Bye, everyone.